Hi, I'm Dr. Mila Brujic, and today we're joined on the OI show by Dr. Jade Coates, where we're going to be talking about life planning on the OI show. Dr. Coates, thank you so much for being a guest on our show, and thank you so much for carving out time for this. Before we jump into it, I want just to give everybody a little bit of a background on yourself. So if you could give a brief introduction, where you went to optometry school, where you're practicing, and what your areas of interest are.
Sure. So I'm a 2016 graduate of the Southern College of Optometry in Memphis. I'm also a graduate of the University of Arkansas here in Northwest Arkansas, which kind of brought me back here to my roots. So now I practice in kind of near the edge of Rogers, Arkansas, Bentonville, Arkansas, better known as in Walmart land, at an optometry co-managed practice called McDonald Eye Associates. And that's where I've been ever since I graduated.
So Jade, this topic that we're going to be talking about today is a little bit of a different one because it's not necessarily clinically focused, but I think as working professionals, I think we all need to be a little bit better versed and understanding about what we're going to call end of life planning and really kind of how you got thrown into this a little bit and just got more well versed. If you could, first and foremost, share with us why you think this is an important topic through your personal family history.
Absolutely. So my personal family history kind of brought me to this point. I have during optometry school, my mom had breast cancer, and that unfortunately kind of piqued my interest into all of the disservice that kind of went on behind the scenes from the insurance PAs that we know about from the dry eye side of things
Yeah.
or the ocular side of things. I got to see unfortunately on the cancer side of things and how patients really truly need medicines and they need it fast. And sometimes they also have hoops to jump through. So, kind of being my mom's advocate when she had breast cancer really kind of sparked this looking into and educating myself further as what I could provide or what the resources that I could share as a caregiver. And that translates kind of as an optometrist because we also currently are in a very close proximity to a local cancer organization where they provide chemo and radiation, and also really close to a hospice organization. And in my everyday clinical life, I might have a patient who's currently actively undergoing chemo or radiation, and just offering all of their resources or local options available. But not only them, they're also their caregivers. And again, that's a huge underserved population, in my opinion. And people might be tired, their eyes might be dry, but they might be neglecting their own personal symptoms because they are truly giving everything they have to caregiving to someone else. So it is something that I ask about my to all my patients are, are you okay? Is your family okay? Are you okay? Are you a caregiver? And it really is kind of eye opening as to how many people are actually um, carrying the burden of providing medical relief and end of life care and services to loved ones at home.
So, Jade, you were kind of talking a little bit about some of the clinical paths in caring for patients, and you have access to those resources regionally. How did you become aware of those? Like, how would somebody locally in their area become aware of resources where they could kind of get more in tune to what's available for caring for individuals and caring for themselves?
Sure. So after my mom's breast cancer diagnosis, my brother unfortunately also had a unrelated osteosarcoma of the jaw. So I was kind of a caregiver again. So I was able to use everything I used the first time as a caregiver and the second time because caregiving doesn't end. Um, my mom is still with us. My brother has been deceased since 2016. He passed away of osteosarcoma of the jaw about 11 months later. And so that's kind of when he was in hospice, I learned the caregiving side, I learned the local resources, and then again, I learned kind of the hospice side of it. After his diagnosis, coincidentally, in 2018, I found out that I had a 7-inch chondrosarcoma tumor inside my own tibia bone. And had I not been kind of an advocate for and in the realm of being an advocate that young people can have cancer too, and to stand up for if you think that your symptoms aren't correlating to how you're feeling, saying, continuing to say something or get a second or third opinion if you feel
So
something's
so
right.
so Jay, to be clear,
Mhm.
When you say being an advocate for yourself or even, like, for those people that you're caring for, you're talking about, I go into the doctor, something doesn't feel right, and they say, "Well, do physical therapy or rest it for a few weeks, and if it doesn't get better, then come back to see me." You're saying, trust your body, you know how you feel, and you know how normalcy feels with yourself, and if you don't feel normal and somebody's kind of brushing it off or the symptoms off, know to take the second step, for another opinion. Is that what you're saying,
Absolutely.
Jade?
Even if it's something that kind of might not pertain to the eyes. For example, if someone says, I stubbed my toe 6 months ago and it's really hurting ever since, or my elbow really hurts. If they say something unrelated, I'm going to say, well, obviously that means so much to you that you just verbalize that in your eye appointment. And although I'm not an elbow doctor or a toe doctor, I'm going to let you know that I want you to know that if that's a problem for you, it's a problem for me. And I want you to know that it's okay to go get that checked. I support you to go get that checked. And I think if I would have had that, I might have found my cancer probably sooner. But it kind of took, unfortunately, caregiving for these cancer patients. After my brother had passed away, I was like, wait a second, I've been complaining of something else too, and I just haven't been heard. But if my doctor would have heard the similar complaints of like, oh, it's just a shin splint. I think I need you know, what should this leg pain, if I would have if someone would have said, oh, well, that's not my department, but maybe you should go get that checked out. I think mine would have been found sooner. So all of these
So
obviously happen for a reason and so that
so
we can
you
talk about it.
you are definitively a glass half full person just by the way that you're communicating it about all this, and you're taking, like, these bad situations and you're saying, "Well, how could I be a better person knowing that these bad things happen, but how can I improve things moving forward?" One of the things that you mentioned was prior authorizations and going through those. Jade, what did you learn about that process being a caregiver for somebody? And what advice would you give to anybody else, listening to this that may be in a caregiving situation?
Yeah, I mean, some of those prior authorizations ended up being life changing and saving in some cases. For example, my the person who found my cancer was actually just a regular so the OBGYN, OB-GYN, and obviously that is not her department, it is the legs. And so at the time, her technician thought it was probably a little bit wild to do a prior authorization for a leg x-ray when that's not their department. And because she did a prior authorization for a leg x-ray on that day, I was able to expedite my cancer diagnosis. And so
Wow.
it's just this happens in other professions too, where it's like, why am I doing what I'm doing? I said they needed what I needed. She's the doctor. This is the patient. We understand the symptoms. Like, let's get it going. Let's get the treatment going. And then there's still barriers and hurdles on a daily basis regarding pharmaceuticals or even imaging. And so that was kind of it for me was that it was, had she not listened, had she not been like, wow, that's not, knees are not my department. I deliver babies for a living. Had she not said, that's, I hear you, could be minor, but you should still go get it checked, and then helped me feel confident in that I wasn't crazy and to go and get it checked. On that same day, I was diagnosed with a 7-inch chondrosarcoma tumor inside my left tibia bone. Same day.
Wow.
Mhm.
Wow, wow, wow. So Jade, it's funny because patients even too, when they walk in, they say sometimes symptoms that they experience and when you can corroborate your findings with what they're experiencing, they'll always say things like, "Oh, great. Well, I'm not crazy." And I always tell them, "I'm not licensed to determine whether or not you're crazy, but what I can tell you is the symptoms that you're experiencing are correlating to what I'm seeing here clinically." Um,
Not saying everything is cancer. It's just,
yes,
you just
yes,
just a reminder that, patients, you do have to be an advocate for yourself, but doctors are also patients. So
yes.
as a patient, you have to be an advocate for yourself. And so I just constantly try to put myself in the shoes of my patients. And whenever I am filling out that prior authorization for a dry eye treatment, I'm like, okay, it's not exactly cancer, but it could
Yeah,
be equally for them in their perspective or in their mind, maybe life changing.
yeah.
So that's why we try to do PAs with a smile on our face because one at a time, as we say, it's like climbing a mountain. But every time we get one approved, we do a little happy dance just in case it really helps somebody.
One step at a time, one
One
prior
step
auth
at
at
a
a
time,
time.
one person at a time. Exactly.
So, Jade, kind of talking about this planning for life, end of life planning, there's a lot of kind of these big question marks around all of this. But were there financial things that you actually ran into as well too? And what advice would you give to practitioners that may find themselves now caring for somebody at the end of their life? And what should even we be thinking about as although again, so I'm going to be 49 in December, but I still feel like a young man, but I realize too that I have more responsibilities with daughters and I want to make sure that everything's nice and appropriate. And I think, oh, okay, I put together a will. That should be enough, right? And give us guidance on from what you saw and what you learned, what guidance you would give, one, for people that are caregivers to other individuals, and two, just as clinicians kind of going through life, what you might kind of just advise to prepare for themselves moving forward as well.
So, for practitioners, I definitely challenge you to kind of know your local resources. And in my area, it's transportation resources, it's financial resources for pharmaceuticals. And again, language barrier, if there's a language barrier, American Sign Language, Marshallese, Spanish, we're able to offer that interpretation. What we find, because in my spare time, I do ride in the vans, part of this organization called Hope Cancer Resource, and I've sat on the board for about 7 years. But in my spare times, I sometimes ride with patients to and from chemo. We go pick them up from their house and we take them to chemo and we drop them off and we get to hear their stories to and from. And what I find is overwhelmingly people say, I would not go to this chemo, I would not go to this radiation if it weren't for this transportation. And so, super basic things like transportation,
Wow.
you don't realize that sometimes people aren't
Yeah.
coming to get their glasses on an annual basis because they literally have other things on the plate, bigger things that they're hoping to make it to, including chemo and radiation. On the flip side, as a caregiver, if you think about it, caregivers sometimes have to go to work to maintain said insurance so that their loved ones can continue this treatment. And so transportation is like the hugest barrier. So if you're going to find like one resource for your cancer patients, know an organization or find an organization that might offer reduced or free or convenient transportation for cancer or radiation patients. So transportation seems to be like the hugest unmet need, with the second one being like financial. Here we're luckily in Arkansas and Walmart and JB Hunt Tyson land. And so with this lovely organization called Hope Cancer Resources, we're able to offer patients financial assistance. So in my area, when someone comes in and they mention a cancer diagnosis, I say, now I know I'm not asking about any financial resources. I don't care how much you make. I just want you to know that there are resources available for financial assistance if ever needed. And that's something that even people who are well off, sometimes when you are up to here with cancer bills, having just a little bit,
Yeah.
knowing where you can
Yeah.
ask without judgment is just
Yep.
really, really nice. So again, I don't ask, I don't care how much they make. I just let them know that financial resources are available.
Uh,
Um, Other than that, again, those are the main two. Again, knowing the transportation resources and the financial resources. Emotional support, I would say, is also up there. That's something that at first, when people get their cancer diagnosis or even caregivers are like, no, I don't need it. I have plenty of support. I'm good. I think it's a little bit, unfortunately, too late, but hopefully we're changing this to be a little earlier, that where patients can go and feel safe and where caregivers can go to release their stress, because it's very, very stressful. And if you caregive for someone with cancer who has maybe a repeat cancer 10 years later, I mean, imagine the burden and the stress of the loved one. So this is a caregiver situation. This is a patient situation. This is a family situation. And just kind of knowing all of them. I'm very familiar with our local suicide hotline information. So if a patient's in my chair saying, well, you know, my cancer therapy is not going very well and it's spreading, and they're telling me that they're very sad, I need to know how to contact their doctor, how to give them resources and things like that. So
Jade,
just
how
kind of
much
knowing the
how
basics.
how much time a month do you devote to this, like to this cause and to volunteering for all of this?
Great question. So probably 20 hours a month, if I had to guess. Since I do sit on several boards, I help make sure that they're um, dispensing their money appropriately. One of the hospice organizations I work for called Circle of Life is incredible because when people are admitted to hospice, like Make a Wish, but for adult, well, whoever in hospice. And so we can grant all of their final wishes. So, how it pertained to eye care recently was a man wanted to go to fishing.
Yeah,
That's all he wanted. And so we don't just go fishing, we hire a guide, we get him a gourmet picnic, we get a nice boat.
right.
We go big, but he needed some polarized sunglasses for this event, right? So
Mhm.
we made sure he had some for his fishing trip, but it's just sometimes like you'll get a quick phone call, time is ticking literally, and we need to make them comfortable. And so sometimes it pertains to the eyes, sometimes it's not. But that's what I do in the behind the scenes of my everyday optometry careers. I am very passionate about educating people about their end of life care, their their local resources um, for cancer patients and caregivers, and just kind of also how practitioners can find those resources so that we can offer them to our patients because it's inevitable. It's probably every day that we experience a patient who's actively either undergoing it, has undergone it, has done it in the past, is traumatized by it, or knows a loved one who's passed away from it. Like it just touches everyone. And I think it makes us better practitioners sometimes if we kind of do ask if they're okay. And if they're not, then provide resources.
Jade, this was great. I appreciate you sharing your personal story, how you got involved with this, and just giving us a little more insights into kind of the stuff outside of the eye care world that some of us may be exposed to, some of us may not be exposed to, and really just in terms of things that we need to give thought around, even with the patients that we're seeing on a daily basis. Even if somebody hears this and they don't do anything other than just think a little differently about the person that they're caring for in the chair, I think this was beneficial. Jade, thank you so much for being on. We're definitely going to have you back on the OI show.
We'll need a part two for sure.
And thank you all for joining us on this episode of the Optometric Insights Show.